So, in the name of our Lord Jesus Christ, Lord, thank you for the gift of knowledge. Thank you for the gift of perseverance and dedication. Lord Almighty, thank you for life. Thank you for the blessing. Thank you for the grace. In the name of our Lord Jesus Christ, I start. So here we are talking today about the abduction. Abduction is just one movement of the arm, of the upper arm, as you can see here. This is the upper arm. So it's one movement of the upper arm that happened in the upper arm. So in this upper arm, what will happen is that, let's say this is the person here, this is the head as you can see, and here is the arm. So the arm here on the side, okay, so this is just on the side. But if this is the arm on the side, if the person have to move the arm about 15 degrees away from it, that will be done by the supraspinatus. And then if the person need to move the arm again away from here, which is from the center of the body, so it will be moving using the deltoid from the 15 degree to about 90 degree, or from 15 degree to about 110 degrees. So from up to this kind of 2 points, to up to 90 degrees, which is going to be this one here, 90 degrees, or at least up to 115. That will be done by the deltoid. And then you can move the arm again from 110, or from the 90 go all the way to 180. So this is 180. Let me do it again in a different way. So this is the straight line. So here is your arm next to your body right here. But if you have to move it around 15 degrees, so maybe a little bit less than that, 15 degrees, that will be supraspinatus nerve. If you move it up to 90 degrees, that will be by the deltoid, or maybe up to 110, that will be by the deltoid. And then if you move it all the way to 180, that will be done by the two other muscles, which is the trapezius and the serratus anterior. Trapezius and the serratus anterior will be working on that area. So now let's see. We say that there is the supraspinatus. So the supraspinatus is right here. This is the supraspinatus. This is the number one, the supraspinatus. This is the one that will take us to a 15 degree. And then we say there is the other one that is going to take us to from 15 degree to more upper, which is going to be the deltoid, this one here. The deltoid, this one, this is the deltoid. This muscle here is the deltoid. There is the same part here on the other side, which is here, but here it is cut, so it's here. So if we put this back right there, that will be the deltoid muscles. So that deltoid will take you up to 90 or 110 degrees. And then from here there is two muscles that will do the next, which is to take it from 90 degrees or 110 up to 180. So your hands are going to be above to the area of your head there. So that will be done by the trapezius, and as you can see, the trapezius is this one here, but the trapezius have three parts. The parts that is descending, which is this one here, let me move that. So the part of the trapezius which is moving downward, which is the descending part of the trapezius, and then there is the middle part of the trapezius, because all the trapezius muscles parts of the all part of the trapezius muscles are going to the scapular, to the scapula here. So they come from the area of the nucus, which is the underneath uh, the occipital bone. They coming from there, and then but they come from the spine, and then they move down to the clavicle. So these are the one that is descending part of it, and then again from the spine going to the scapula, that is also which is the middle part, and then again from the spine going in here, but it's the lower part of the spine, from the areas of the from the areas of the thoracic area. This is the thoracic area. So the lumbar area is down here. So it may be, I'm not sure if it's maybe taking some of the lumbar, or is this all the thoracic, because I don't remember that one. So um, if you need to know that, but for me I don't need to know that now, but we know that is starting in those areas. But then, so that is the trapezius, but we have another one, which is the serratus or the serratus anterior. Where is here the serratus anterior? So this is the tricep, this is the teres, this is so the serratus anterior should be on the anterior part of the body. So that is a different muscle. So let's see that muscles. Where is it? So here I'm gonna find that muscle and then add it here. I'm gonna take this muscle here and I'm gonna add it here. I'm gonna find it and then I'm gonna add it here. So here are those muscles. Here is the muscle here of the serratus anterior. So here is the serratus anterior. Let's copy this one, but I can do this actually and move them to my notes, which is, I'm just gonna move it here to the notes so that we know that this is the other part of the muscle. So I'm gonna move one. I always like to move the one that will make me see them better. So as you can see, I have the deltoid here, I have the latissimus there, I have, so this one also will be a one that can make me see them better. So I'm just gonna move this one also. And here I'll bring this there, I'll bring this way. So I guess that is it. So let's just do this here. Let's just do this here. This one is not gonna be good in that area because it's a clear picture, so it's gonna show everything underneath. So this one is better in this area here. Okay, so let's see here. So we said that the deltoid, this is the one that goes to 90 or up to 110, and this is the pectoralis major. We didn't talk about that one. This is the serratus anterior. So this is here the serratus anterior, and there is the latissimus. We didn't talk about the latissimus dorsi, so that is going to be there, bicep pectoralis. So that's the only thing we were looking for. So this will be, as you can see, to find the serratus anterior is going to be the anterior part of the body in the anterior, and is going to be just kind of sandwich underneath the latissimus dorsi. So you see it here, the green one, latissimus dorsi, and it is underneath the pectoralis major. And then here, as you can see, we already took away all the other muscles. We took away the pectoralis major, we took away the latissimus dorsi, and we're looking at the insertion of it in the scapula. As you can see, all these muscles, they are inserted in the scapula. They are inserted in the scapula, so that's why they will be able to move the arm, because they are inserted into the scapula, and the scapula is kind of part of the arm in the area of the joints. Okay, so those are all the insertion there. With the deltoid is also the inserted in that area. So let's go again. So we know now that these muscles, they will do this kind of an action, and this is the only action here, which is the abduction of the arm, which is to moving the hands away from your body, away from the midline of your body. So we say the supraspinatus, this is innervated by the suprascapular muscle, the suprascapular nerve. So that is innervated by, I'm reading from this one here, from this area. So it is innervated from the suprascapular nerve, and the supraspinatus, we say that it will take from 0 to 15 degrees. So here these are the so this is we will do something that is called the drop arm test. And the drop arm test, and we also need to know the most tone muscles, for example the muscles of the rotator arm. This is number one most tone, so this is the number one most injured. Okay, so the tear will happen here most of the time. And this is, so if we ask the person to passively abduct the arm, so you will passively abduct the arm to 90 or more. So 90 or more, abduct the arm and slowly lower the arm. And if it is not fluid, which is the movement of the arm down, if it is not fluid or if it is not normal, it will get catch or is not lowered in one motion, then this will be called positive, and that will mean a tear or a dysfunction of these muscles here. So that will be a tear or a dysfunction. Okay, so dysfunction in this muscle here. So that will be again a drop arm test. Drop arm test, pick it up to 90 degrees. After 90 degrees, you start lowering. Your lowering of the arm is supposed to go fluid. It's supposed to be fluid, and it's supposed to go smoothly down until it gets to the towards the midline of your body. But if it get caught on the way, it doesn't, or if it doesn't go smoothly, or if the movement is not fluid, then we say that there is a tear or there is a dysfunction of the suprascapularis muscle. So we got that down. Let's go to the next one. We say the deltoid, we'll take it from 15 to 90. And the deltoid dysfunction can happen in many for many reasons. One of the reason, or one of the most the one that happen all the time, that will be the anterior dislocation of the shoulder joint. So the dislocation in the shoulder joint, that will be the number one injury in this area. That will kind of damage to the axillary nerve, and that will cause the deltoid dysfunction, and which is that the deltoid will not be able to raise the arm. The person will not be able to raise the arm, not the deltoid. So the person will not be able to raise their arm from 15 and above it, which is up to 110. So, but also there is something that is can be transient, and the transient will be the injury to the axillary nerve. That can be transient, and these happen that there will be a dysfunction just the same way as the dislocation, but this one is a temporary, and it will there will be a spontaneous recovery from this one. Number two or number three muscles, which is the trapezius. We just show you the trapezius where it is, and then the serratus anterior. We already saw the serratus anterior in the frontal part of our chest. So these two muscles, what they will do, they will take the arm away from the body, away from the midline, which is the abduction or abduction. That is going to be above the 90 degrees or above the 110 degrees. And this one here is going to be happening if there is an injury to the trapezius muscles, which is innervated by the accessory nerve, which is the nerve number 11 of the cranial nerve. That will cause the lateral winging of the scapula, as you can see in this picture here. You can see in this picture here. So here, as you can see, this person, when they are asked to move the arm, with the arm movement, you can see the winging of the scapula, which is the scapula is not no longer attached to the body. You see there, it will be winging. So that because of the trapezius injury, that will be the lateral winging of the scapula. Now, if it is the serratus anterior, you saw the serratus anterior. So if the serratus anterior is the one that is injured, so we will have the medial scapular winging. Okay, the medial scapular winging, and this is the serratus anterior is going to be the problem with it will happen if there is an injury to the long thoracic nerve. So all the muscles that innervate in this area, which is all the muscles that abduct the arm, we have the mnemonic that is called the SALT. The SALT for the suprascapularis, axillary, accessory, and a long thoracic. So all these muscles, they will be emerging from the C5, C6, and C7. We know all the muscles will emerge from the spine. And the C here, we're talking about the cervical, the cervical area. So, okay, so this is the spine here, and they will be emerging C5. We know C7 is this area. C7 is kind of in this area here. So the 5, 6, and 5 will be above it. So all this area, that will be the innervation that is going to go to these muscles. C5, 6, and 7, raise arms to heaven. C5, 6, and 7, raise arm to heaven. Okay, so we are done with this one here. So I'm just going to read, which is the same thing actually. So the 0 to 15, abduction of the upper extremity is initiated by the supraspinated muscles, which is innervated by the suprascapular nerve. And then from 15 to 110, which is further abduction to the horizontal position, is the function of the deltoid muscles. Axillary nerve is the one that innervating. And then from 110 to 180, which is raising the extremity above the horizontal position, require a scapular rotation. So there is require a scapular rotation. So the scapula need to at least a little bit rotate in order for that arm to go above. So the scapula need to do the rotation, but in the other area there is no rotation in it, but this one need a rotation of the scapula. So this one here, this action is being done by the trapezius, which is the innervated by the accessory nerve, which is number 11, and serratus anterior, which is the long thoracic. And remember, 5, 6, 7, raise your arm to heaven.